When the pandemic hit, a lot of the clinical training for medical students was stopped. And so I found myself in a situation where it was in the middle of my clerkships, and I was able to go back to kind of doing some research projects. Dr. David McManus, who was in charge of figuring out the logistics of field hospital and how we're going to care for patients with COVID infection. There were about 700 patients that had already gotten care within the UMass system. So we could use those 700 patients as training data set. Part of the challenge was we can get the data from the clinical side and electronically abstract it, but how do we know that that's accurate? And so what we were able to do is recruit 50 medical student volunteers who went through about 1,000 patients' charts in a matter of 3 days, and were able to help validate the data that we were getting. And what the end result of that was a clinical score that got integrated into the medical record system and was then used to transfer patients to their appropriate level of care.